morning, everyone, and I would first like to thank ILSI for inviting FDA to participate today. I'm very excited about this afternoon, and I'm looking forward to hearing everybody in detail about the information that you have to share today. So for those of you who I have not met yet, I have been with the Center for Food Safety and Applied Nutrition for about 4 years. I'm in the Office of Food Additive Safety in the Division of Biotechnology and GRAS Notice Review. And the project of sodium is what I've been working on. It fell in our division because salt or sodium chloride is currently generally recognized as safe. And so today what I'd like to talk with you about is just to recap the importance of sodium reduction, FDA's commitment to sodium reduction and the fact that we've maintained that over time. Based on some of the information that we have access to, I'll highlight some considerations related to food reformulation. And then I'll present an example of a food category showing how the information that we have allows us to look at that category. And my main point is to emphasize our path forward in that we would like to take collaborations to another level. So there's a problem out there in that sodium reduction, in that sodium intake is too high. And many of you in this audience know that. It's an important public health issue because it leads to high blood pressure, which can be followed by cardiovascular disease and stroke. And recent estimates have shown that by reducing sodium intake, you can save a number of lives. There's been a lot of scientific studies that have come out over the past years, and there has been some controversy about those studies. And there have been different groups to look into these studies, including the Center for Disease Control and Prevention. And they have identified various methodological concerns about these studies. But the weight of the evidence still does support sodium reduction. And in 2013, the IOM continued to support the fact that we should bring sodium to 2,300 milligrams for the population. Other groups as well, including the Dietary Guidelines for Americans, and around the world, the consensus is that sodium should be reduced. In fact, there are a number of other sodium initiatives, and even as many as 50 countries have sodium initiatives that focus on different areas and may be mandatory, may be voluntary. They're all a little bit different. Sodium reduction for FDA is not a new thought. We have continued activities through the years, and more close to 2010, we convened a task force which transitioned into a working group for sodium when the IOM report came out. And we shifted gears to start to focus more on the food supply. Part of the reason being, and Christine mentioned this, but over the past 40 years, consumer education and labeling has been the main focus, and that really has not worked. Also, the IOM report emphasized the fact that we should take a systemic approach and move gradually in reducing sodium. And part of the reason for this would be that we are very concerned about maintaining food safety in the food supply, and that we want to give time for consumer taste to adapt over time, with the ultimate goal being that consumers would have more options available to them at the grocery store when they sit down to eat a meal at a restaurant. And this will take a concerted effort by all of us working together. Since 2010, FDA has been very public about what we've been doing with sodium, and on this slide I represent a couple of our strategic goals for sodium. 2 documents that are listed here are available on our website at the link shown on the bottom. And we indicate that we're considering targets for sodium reduction, as well as the fact that we'll be monitoring food in the food supply in partnership with CDC and USDA. But the real question is how are we going to get to the place where this is a sustained effort that has a true public health impact? And more importantly, how do we best achieve success considering sodium plays a different role in different foods? So we wanted to hear more, and in 2011 we opened a docket to solicit input on some of the technological challenges for sodium reduction. We received about 100 substantive comments, and we asked a series of questions in this docket. I've provided a couple of examples here. And we asked about the information gaps that were identified by the IOM report that related to technological challenges. We also asked about, we wanted to gain insight on what would make sense in terms of establishing targets. For example, does it make sense to look at foods by category? And then we followed that with a public meeting in partnership with USDA and CDC to receive more comments. So on this slide are some of the themes represented from the public comments, and they naturally kind of fell into three buckets. The first relates to how sodium reduction would impact consumers, and then just the element of importance about considering the factors that relate to food reformulation and what those challenges are, and then what matters to industry in terms of how will they want to move forward. Across the board, we heard that gradual change is critical, and to highlight some of the points that were more common, we know that products need to sell in the market and that they need to taste good to consumers, but we need to understand what those technical challenges are in terms of being able to make the foods taste that way and maintain safety, and the fact that we need to include all food sectors in the discussion so that we can have a level playing field and ultimately achieve the goal where consumers' tastes are changing and it has a public health impact. So honing in a little bit more on today's focus related to the food reformulation aspect, we know that there are challenges with food reformulation, and we know that sodium ingredients and salt play many roles in food that surpass flavor. We want to move carefully to make sure that we're maintaining food safety, but we really need to hear more specific information from you as the experts. A lot of the comments that we received were very general, and we're able to look into the literature, the public literature. However, a lot of what we saw was really studies that come up with some kind of proof of concept, but it may not be applicable across the broad scope of a category or a product. We know that each category is different. We know that each product is different. So we just really need to hear from you about what's going to make sense at a more of a detailed level. And then there are a number of new technologies that we'd like to learn about. We need to understand what the progress has been there, and if there was any success with what those alternatives are, what the challenges have been, are they really going to be feasible? This slide represents some of the available information that we have when we look at a food category. As I mentioned, we can look into the scientific literature related to food technology, but there are limited studies and it's really kind of more general information. We also have access to food label data, which presents nutrition information, ingredient information, as well as sales data so that we understand what's selling on the market. And then we've consulted with internal experts to learn more about different food categories, such as the Food Safety Inspection Service on meat. And there are other initiatives, of course, that we've been taking a look at and reviewing to better understand how they've made change through time, and targets have changed over time, why have those changes been made. This slide is an example of the information that I just talked about, how we can look at a category. And in this instance, I'm representing cooked sausage here. We looked at a sample of 65 brands that are high selling, which represented over 250 products. And the chart on the left shows that there's a wide distribution of sodium that's selling. And importantly here too, you can see that there are some lower sodium products that are still high selling. Again, the information that we had related to food technology was really kind of general, so this is where we really need to be hearing from you as the experts about what is specific to your products, and we understand that each product that's represented here is different. Also, the information from the other initiatives, I have represented here a target for New York City, and you could look at that and have the target compared to a particular category. So FDA's main goal related to foods is food safety, and we have many tools that we can utilize. The first of those relates to our authority over food ingredients, and we could potentially issue a regulation. Also consumer education, and oftentimes we partner with other agencies like CDC on that. And then we have purview over labeling, so that consumers can better understand on a package what that food means to them in terms of their dietary intake for the day. These three examples of tools come together to impact dietary intake, which can improve health outcomes potentially. And typically FDA has looked at safety evaluations with toxicity as an outcome. And so this is another paradigm where we're paying attention to nutrition concerns and chronic health outcomes as the endpoint. And just to pause again here and emphasize the fact that it's really going to take a true collaboration. We have collaborated with internal partners, other federal agencies. We've talked with other governments. We've had some of you in the audience approach us, but we really want to take that to another level and hear the detail. So, where are we headed? FDA is committed to sodium reduction, and we want to make this work. We know that you have more information than what we have access to, and we'd like to hear about what that means in terms of successful reformulation and how we can have a true public health impact. So we want to base it on available scientific data. We know it needs to be gradual. We want it to be something that is really beneficial to all parties that are involved, including consumers, industry, and public health agencies. And in summary, of course, sodium remains high in the marketplace, so we have to do something about that. We've shifted gears, we've started thinking about the food supply, and this is really an opportunity for us to just truly make change in a different way. And collaboration is critical for this effort to happen. We really need to be hearing more technical information from all of you. I've emphasized that a lot through this presentation because it's the truth, and we want to work together to make that happen. And so I'll be listening very closely today with the presentations, and hopefully this can be a first step in a continued dialogue. Thank you.